This Time to Talk Day, we want to start a conversation around suicide. Even a small conversation about suicide has the power to make a big difference. Whether you are experiencing thoughts of suicide or supporting someone who is, you are not in this alone. If you are having thoughts of suicide, reach out to someone and tell them what's going on. People can experience thoughts of suicide for any reason, and many may not have spoken about how they're feeling before. This makes it so important that we know how to respond when someone does disclose thoughts of suicide to us. We've collated some of our top tips for you here using the acronym ALONE. Acknowledge that you have heard their distress. Let them know if you're able to support them, or if it's better for your own mental health that you signpost them to another service. It's really important that you're transparent here about how you feel able to help. Remember, you're not alone either. There's lots of support for both of you to access. Listen actively and give your full attention to what they're saying by asking more about their feelings and thoughts. You can also show your listening by summarizing, clarifying, or repeating back what they have said. You can further the conversation by asking open questions that require more than a yes or no response. You may want to ask about the frequency of their suicidal thoughts, whether they've made any plans, or even about their reasons for living or dying, but remaining non-directional so they feel in charge of the conversation. Being non-judgmental means not placing any criticism or blame, not trying to jump to an easy solution, and not changing the subject away from their distress. Do encourage them to continue to seek appropriate help and remind them that they are not alone. Depending on the situation, this may be the emergency services, their GP, or other forms of professional support. Ask whether they want to follow up with you or someone else to check how they're feeling later on. To demonstrate the components of this acronym in practice, here are some examples. To acknowledge you have heard their distress, you might say, "Thank you for trusting me with this. I'm here for you." To show you're listening, you might say, "Would you like to tell me more about how you've been feeling?" An example of an open question might be, "How safe do you feel right now?" A non-judgmental question you might ask is, "What would you like to happen?" To encourage them to seek further help, you might say, "Have you considered speaking to anyone else about this?" For further support for yourself or someone else, contact your local Nightline during the night or Samaritans 24/7.